We're doing another Ask the Doc today, and we're joined by interventional radiologist Dr. Wes Lewis. Thank you for joining us today.
Thanks for having me.
We're going to talk about a topic that's very important and has affected many people, family, friends, and you may know someone who has been affected. And that topic is stroke. And we are going to talk and simplify it today and let you tell us exactly what is a stroke.
A stroke is, we'll talk about stroke in general terms. Stroke is any time that blood is cut off to some part of the brain. We break stroke down into two large categories. There are ischemic strokes and there are hemorrhagic strokes. And the most common type is an ischemic stroke. An ischemic stroke is when a blood clot goes to some part of the brain and blocks blood flow. The hemorrhagic stroke is where a blood vessel will rupture, and that then the bloodstream downstream from that will lose blood flow.
Okay.
So those are the two main types.
And what kind of symptoms should our viewers look for? And why is it so important to get to the hospital quickly?
So the main symptoms, and most people have heard of some of these symptoms, and so anytime you may lose speech, okay, so if you all of a sudden start slurring your words, or you can't understand, or you can't speak, or you lose the ability to use one side of the other of your body, or your main thing. One thing that some people don't realize maybe is if one side of your face becomes paralyzed, so it looks like that one side's normal and one side's kind of drooping. We have a little acronym called FAST, and it's face, arm, speech, and the T is for time, and time to get treatment. So I always tell people if you can't feel or don't feel anything or can't lose use of that side of your body, that's big sign.
And I know once you start seeing these symptoms, time is of the essence, and it's very crucial to seek care. Why is that so important?
Well, obviously, if you cut blood supply off to any part of your body, then the cells distal to that start losing their ability to function. There's been studies and stuff that's published by the American Heart Association, American Stroke Association, shows that in the first minute of a stroke, you'll lose 1.9 million brain cells, and that continues to escalate with time. So obviously, the longer you wait to seek treatment, so immediately when you start having these symptoms, you should start seeking treatment, whether that's call 911 or get to your nearest emergency room to mitigate the number of cells that are lost. It's a little bit more complex than that in the fact that everybody has lots of blood vessels, and so once you cut blood flow off to a certain area of the brain, your body will try to get blood to that area as best it can, and we all are a little different. It's like everybody has a fingerprint, everybody has a little bit different collateral, so you may be lucky and have more collaterals and you could survive a little longer, and you may not be as lucky and you don't have as many of these what we call collaterals, or the little blood vessels that get around the blockage, and so you have less time. But everyone should seek treatment as fast as possible.
Immediately.
Yeah.
So what are some risk factors that people should look for that might increase their likelihood of having a stroke?
Well, I think that all cardiovascular disease has similar risk factors. So if you have high blood pressure, that's a huge risk factor. If you have diabetes, that's a huge risk factor. If you have elevated cholesterol, that's a huge risk factor. If you have an unhealthy lifestyle, that's also a huge risk factor. So those are your major ones, and we could probably say that for most cardiovascular diseases.
So that pretty much answers my next question as to what we can do now in our daily lives to prevent, that likelihood. And I guess it's exercising, eating right.
Yeah, so that falls under your healthy lifestyle. I mean, I think that the healthy lifestyle choices. I've practiced here at King's Daughters now for 20 years, actually over 20 years, and so one of the biggest things I see in our area, and something that people that work with me know that I preach about a lot, is smoking. And so, and a lot of people don't want to talk about it, and I think it's pretty ubiquitous now in our culture that we tell people to stop smoking. But if making these healthy lifestyle choices, don't smoke, don't eat a lot of fried foods. Watch the number of calories that we take in during the day. Those are all things that we can positively impact. Try to get as much exercise as we can. If you could exercise 30 minutes 2 to 3 times a week, that would certainly impact your life. You'll live longer. So everything in moderation. I think
Right.
moderation is key to most things in life.
Right. And circling it back to seeking treatment, I've had a family member that has been affected by stroke, and sometimes it seems like they don't want to bother people, or they don't want to seek
Sure,
care when they
sure.
should, and it's better to be safe than sorry.
Well, it is,
Correct.
and so we see a lot of patients through the ER every day, and we evaluate those people with stroke. And stroke's a little bit different than, say, a heart attack. A heart attack, we can hook most people up. We can do a blood test, and we can see if you're having a heart attack. We can hook you up and do an EKG. And stroke is a little bit different than that, because really it's very imaging dependent. The two main categories of stroke are the ischemic strokes and the hemorrhagic strokes, and 80% of the strokes that we see are ischemic strokes. And again, that's where a blood vessel is blocked on the inside by a clot, and that clot could come from your heart. That clot could come from, say, a carotid artery, or you could have pre-existing maybe disease in the carotid artery, and for whatever reason your blood pressure dropped. And if your blood pressure drops and you have a blockage, then blood can't get through the blockage as well with a low blood pressure. So those all fall under that ischemic stroke category. And then the hemorrhagic stroke is where a blood vessel is weak, and then where the weak blood vessel is, it can rupture. And the most common cause of that weak blood pressure, or the rupture, is high blood pressure. So people that are hypertensive, the small blood vessels in the brain can rupture and cause this hemorrhagic type stroke. And those can be particularly devastating. They're much harder to treat because we don't treat those by normal means. We've got to get your blood pressure down, and then hope that and it is a little bit of hope that the clot inside the brain doesn't get larger. And a lot of times that has to be a surgically managed thing. So anyway.
Great. That's great information, and I think our viewers, will know to look at the symptoms, recognize them, get to treatment as soon as you can. It's better to be safe than sorry, and watch those risk factors like blood pressure, make sure you're eating right and exercising, and all of the cardiovascular risk factors you mentioned. So thank you so much for your time today.
No worries.
This education is very important, and hopefully our viewers have some more information to guide them.
Yeah. So just in closing, I'm a big thing on education, and I think most people are aware of the risks. What people do when they have a heart attack, they'll put their hand over their chest. That's a sort of a nationally recognized thing. If somebody with a hand over the heart is a recognized thing, and I would just ask people to remember FAST, F-A-S-T, and that's face, arm, speech, time. Face, if somebody has a facial palsy, if you come up on somebody and they look at you and their face looks asymmetric, maybe their speech is very garbled, they can't speak to you, they may not understand what you have to say, then it's time. It's that time to call 911. Kind of recognize what time you saw them the last time they were normal. That becomes very important, and something we touched upon earlier that we didn't really expand upon was that you need to get to the hospital as fast as you can, and the reason is you want to save brain cells, and we have some time limits that we're looking at there, and if you can get to the hospital within 4 to 4.5 hours, you are in a window for what we call TPA, treatment for this ischemic stroke. So if you get there and you don't have hemorrhagic stroke, then you would be a candidate for TPA, which is sort of the gold standard right now for treatment of ischemic stroke. And then also we would do the CTA and the CT perfusion exams. And then if you were to have a large blood vessel that would be blocked in your brain, then you would also be a candidate for us to go in, or somebody like us to go in and retrieve that clot and restore blood to that part of your brain, just like we would go in if you were having a STEMI and a heart attack. We'd go in and they prop the blood vessels open and get the clot out. We'll go in and just aspirate that clot out and restore blood flow.